It's almost 11 a.m. here in Seoul. I'm Oh Si-young at the Arirang News Centre. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. Director of Health Policy Yoon Tae-ho will be providing us with a briefing on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the spurt of cluster infection cases in Seoul City and the capital area. It looks like the Director General has taken to the podium and he will begin the briefing shortly.
Let us now begin our regular briefing for August 24th, Monday. As of today midnight, we have a total of 258 new local infections. And for 1 week straight, we are seeing more than 200 cases on a daily basis. It looks like we have a slight decrease in the number of new cases today. However, we shall not be overly interpretive of this number because we had a slight decrease in the number of tests over the weekend. We believe that from this week we will have yielding results of the previous 2 weeks of intensified social distancing measures for the metropolitan area. However, we believe that they will be unfolding starting from this week. And we believe that the effects of social distancing is rolled out the following week. So we also ask you to abide by the social distancing measure level 2 going forward. Today we had 201 in the metropolitan area, and they account to over 3/4 of the entire number. And we also have many other local provinces and cities that have seen infections on this Monday. And we also have about 20% with unidentified sources of infection, and those are under investigation. And we believe that the risks of further spread of the infection is also at a very intensified rate. And therefore, we also intensified the level 2 distancing measures for all of the country, not only in the metropolitan city. And we believe that the cases stemming from a specific church and the Gwanghwamun rally will unfold this week. We believe that this week will be a very critical moment, and we ask the members of the public, wherever you are, also always stay vigilant and please note that you may be exposed to the virus at any place and at any time. At such grave conditions, we also have local governments exerting their full efforts to contain the virus. In cities of Seoul, Sejong, and Jeju-do Island, they have mandated all of the citizens to wear face masks. And out of the 13 provinces and cities, 17 provinces and cities nationwide, 13 of them are making these measures compulsory. And starting from this October, in accordance to the Infectious Disease Prevention Act, if there are breaches on these measures, including wearing face masks, will be subject to a penalty of 100,000 won going forward. And as this is a compulsory measure, we ask for all of the residents and members of the public to comply with this measure. And in accordance to the level 2 social distancing measures, all of the high-risk facilities will be suspended from operation. And we also ask for other multi-use facilities to abide by such quarantine measures. And in Seoul City, starting from today, concert halls, weddings and restaurants, as well as private academies with over 300 people will be under a strict inspection. And as for the principle of 3 strikes, if they continue to breach such these preventive measures, they will be asked to have a penalty as well. And the Seoul City also banned the gatherings of more than 10 people, and the same measure has been put in place in the city of Incheon. And we also highlight the fact that these risks of infection spread, especially through these demonstrations and gatherings, and therefore such measures have been put in place. The non-metropolitan area are also exerting their full efforts to contain the virus going forward. In Busan, they have applied the principle of one strike, one out system, and they also asked all of the churches to only carry out online services. To this end, they inspected a total of 1,765 churches in the city, and they have inspected whether they were abiding by such quarantine measures, and they also took administrative orders for those who have breached these orders. And during the weekend, we also noted that there were a great participation by the religious circles in having all of the religious meetings through online means. And we continue to ask you to refrain from having group meals, group gatherings, choir practices, and so forth, so that you could enjoy a very safe services online. And in the non-metropolitan area, we ask the local governments to monitor the situation so that our level 2 distancing measures could be complied by. And next, we have some measures to intensify the self-quarantine exemptions for the foreign entrants. And we also would like to say that these are subject to those companies and employees who have prior requested for such an exemption, and they would be able to be exempted from self-quarantine, considering diverse factors like the objectives and the importance of their projects and business as well. And these periods will be determined and would only be restricted to a certain time of period. And we will also consider the measures for also exemptions for the self-quarantine for the funerals, and they will be only subject to family members, including spouse and offsprings as well. And we will also intensify these measures going forward in order to curb the further spread of the imported cases going forward as well. And as for the entire walkout by the medical practitioners, we have a few announcements. Last night, the Prime Minister Chung Se-kyun sat down with the members of the Korea Medical Association, and they also agreed to resume medical services in relation to COVID-19. And we are faced with a very grave crisis of a widespread of the COVID-19, and we would like to welcome the decision to resume their medical services in this area. And we note that many ICUs and the surgery rooms and ERs should also be resumed as well. And as for the walkouts, we would like to highlight that no patients' lives should be put at risk. So we ask for you to resume other medical services as well. The government is willing to engage in candid dialogue with the medical practitioners, and we will proactively seek ways to improve our negotiations. And as for the reason of a lack of the numbers of doctors in the metropolitan area, we also agree to your view and stance. And throughout these pandemic, we have learned also that we have a need to nurture our public medical sector as well. And we will also ensure that we have more public hospitals in the region provinces, and we will also make sure to expand our support for the public hospitals. And we will also provide more systematic and financial support for all of the medical practitioners, not only in the public sector but also in the private sector, so that the people and the medical practitioners in the other regions would also be receiving similar wages compared to those who are working in the metropolitan area. And we will make sure that we will create the necessary environment to enable more doctors to be willing to work at these provinces nationwide. And we ask, and we look forward to engaging in candid dialogue with the medical practitioners. If we fail to flatten the curve this week, we believe that we will be faced with a very important crisis, that the virus will spread to the entire nation. It is time for us to have concerted efforts and to intensify a sense of consideration and understanding to overcome the crisis as a whole. During this week, even though it may be inconvenient and discomfort, we ask you to stay from home and to make not unnecessary gatherings and events. Please cancel all of these unnecessary gatherings and events, and individuals should also need to exert their full efforts as quarantine agents. We believe that distancing measures, abiding by distancing measures and wearing a face masks are the only solutions to curb the virus spread, and we ask for your cooperation and support. Thank you very much.
That was Director General for Health Policy Yoon Tae-oh telling us about the latest infection numbers here in South Korea. He just told us that there were 266 additional infection cases of COVID-19, bringing the accumulated total to 17,665. There were, however, no additional deaths, meaning that the death toll now stands at 309. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.